So let's talk about the investigational approaches towards hematuria. The first step to reach a diagnosis is to take a history. The history in case of hematuria should include the timing of hematuria in the urinary stream. Blood on commencing urination suggests a urethral cause, whereas terminal hematuria suggests a bladder or prostatic cause. The presence of painful urination suggests a urinary tract infection or calculus. Episodes of trauma should be sought, as should systemic features that might indicate a disseminated malignancy or a vasculitis. The examination must include palpation for abdominal masses, which might represent renal tumors or cysts, a rectal examination for prostatic malignancy and measurement of blood pressure. Once the presence of hematuria has been established, urinary microscopy may be indicated as first investigational approach, whether the source is likely to be glomerular or from elsewhere in the urinary tract. Red blood cells of glomerular origin tend to be dysmorphic and may be accompanied by red cell casts and significant proteinuria. Glomerular disease can affect renal function, which should be assessed with plasma creatinine and is often accompanied by proteinuria. Abnormal urine cytology can suggest the presence of a urinary tract malignancy. If a structural region of the renal tract is suspected, we need to proceed with the imaging that might be undertaken with plain radiography looking for radio-opaque calculi, although only a small minority of stones are visible on plain X-ray. Ultrasonography looking for renal masses or bladder lesions. Intravenous urography IVU, particularly looking for filling defects within the urinary tract. Cross-sectional imaging with computed tomography CT or the magnetic resonance imaging, that is MRI. Now remember to be cautious with iodinated contrast media in patients with renal impairment because of the increased risk of contrast nephropathy and the rare skin disorder nephrogenic systemic fibrosis that can be associated with gadolinium. So after MRI, if these investigations fail to demonstrate a cause for the hematuria, a cystoscopy should be performed. If a renal source of the hematuria is suspected, usually because there is proteinuria or biochemical evidence of renal impairment, a renal biopsy may be undertaken which could reveal a glomerulonephritis. The most common renal cause of microscopic or macroscopic hematuria is IgA nephropathy. In this condition, the hematuria commonly follows a sore throat. Bleeding disorders are a very rare cause of hematuria, but should be looked for if the patient has other sites of abnormal blood loss. This was all about the term hematuria. I am sure that now you would be able to explain to the patient about its possible etiology and get on with its investigation techniques. So guys, we have released a video on dysuria as well. Do not forget to watch that too. Keep watching sqadia.com to learn something new every single day.